So first, when I heard about BFR training is blood flow restriction training.
It's been around for a very long time in the world of bodybuilding, although BFR is slightly different to occlusion training, it's more a restriction training.
The difference between BFR and occlusion training is that occlusion training is literally having a tourniquet around the arm and stop the blood flow and start training and stressing those muscles. Now the BFR is slightly different. It is a much more monitored way. We are restricting the blood flow instead of actually stopping the blood to getting down to the limb.
Several of our best known football teams around the world use it and swear by it, and some of the results that we've been seeing in the literature are absolutely staggering. And as a surgeon, we always want to get the best results we can for our patients, and if that means 1% incremental gains for marginal improvements, that makes all the difference at the elite level performance. And so that's the reason we want to get involved with such a well-known and reputable group such as the MADUP company.
So MADUP is a machine that enables us to do the blood flow restriction training. It's approved by the FDA, and it is a very effective and safe way for me to be able to prescribe BFR to my patient. It is not just for athletes, especially with the help of the MADUP machine. It actually helps us to prescribe very efficiently to our patients safely. But with MADUP, they specifically have a design within this machine that can regulate that pressure, and that's extremely important. So at no point this blood flow is stopped. So we are using blood flow restriction instead of blood occlusion, and that is the main feature why I want to use MADUP.
Yeah, I think that the vast majority of my patients aren't athletes. They're patients who are recovering post-injury or are waiting for surgery because of the pain that they have. So the ability to be able to use the different protocols for each individual patient is hugely beneficial. I'm able to address the issues regarding the pain, the low intensity training. I'm able to give them a schedule of exercise therapy that suits their clinical need, all because of the capabilities of the MADUP program.
So I use the MADUP device and the BFR training quite often on these patients also, because we are able now to use with the BFR, with the 20 to 30% of the 1 rep max training, we can actually achieve similar result in keeping that muscle active and saving and preserving that muscle. By doing so, patient can actually recover quicker because the muscle is actually there. So after we give them a brand new knee replacement, people can walk much better because the actual powerhouse, the muscle fiber is there and is ready to go.
The main benefit that I've seen for BFR to my patients again is to that low tolerance of high load. So we flip it right around and decrease the load and increase the volume, which is showing great effects with some of the patients today over a very short period of time, really. Both objectively and subjective feedback from the patients has been excellent.